Welcome back, folks. We continue talking to a whole range of folks who are dealing with COVID-19, longer term in particular. And we're joined by Richard Uniacke, who's Executive Director of Bridges Outreach. Richard, good to have you with us.
Thank you, Steve. Appreciate being here.
Describe the work of Bridges.
Typically, we engage in street outreach runs in Manhattan, which is our origin story, as well as Newark and Irvington, and we open our doors at our Summit office to our neighbors in need there. Despite the fact that the numbers are generally smaller, we do have some folks experiencing homelessness in Summit as well. So pre-COVID, we were focused on outreach and engagement with folks, providing them with basic human needs right there on the street, week after week. Also, case management at our drop-in center in Newark on Halsey Street. So preventing imminent homelessness, connecting people with shelter, with benefits, with housing, providing access to showers, things as simple as that, and medical care. And then also engaged in really a systems change effort. There's a process called Built for Zero, which is how Bergen County, New Jersey became the first community in the nation to achieve what's called functional zero for chronic homelessness. So we want to be like Bergen. We want to follow that path. It's a continuous improvement model. So we've been working with the city and the county COC as well. So enter COVID, things look a little different.
How different? Describe, sorry for interrupting.
Not at all.
One of the challenges of producing this way. Richard, put in perspective the challenges, the unique and difficult challenges those who are homeless are facing in the age of COVID-19 as we tape in the middle of May.
Yeah, so people who are experiencing homelessness are uniquely susceptible. You know, they live a fairly unhygienic life if they're outside, if they're at shelter, they're living in a congregant setting. They're doing all the things that we are all told not to do. And put it simply, they can't stay home, right? If you don't have one, you can't follow those orders. So when the guidance came out that anybody who had recently been in New York City should self-quarantine for 14 days, this has been more than a month now, we decided it wasn't safe enough to bring our volunteers or our staff into New York City anymore for the time being. So we focused on Newark, and we really leaned in and redeployed everybody who could be redeployed to the streets of Newark in effort to engage with people who are experiencing homelessness and to get them into shelter or to get them into immediate medical care, you know, asking them the basic triage questions at first. Do you have a fever, cough, shortness of breath, and have you been around anyone who does? And including myself, we've been out there now since about March 22nd, 7 days a week until 11 p.m. at night. And in partnership with the health department and with the city and with the Newark Essex COC, I can tell you what turned out to be a really urgent and kind of scary scenario, because there aren't enough shelter spaces. And we know that there's a fairly large contingent of folks, particularly in Newark, which has by far the most people experiencing homelessness.
Including veterans.
Including veterans, absolutely, who just simply wouldn't go into a shelter, especially not a congregate shelter. So what the city did, which has been really remarkable, was to stand up 2 hotels that would be used as shelters. One, an isolation shelter for folks who were COVID positive, not sick enough to need a hospital bed, but could not isolate at home. And the other, simply an alternative shelter with individual hotel rooms for people who are experiencing homelessness, and 3 meals a day and wraparound services. And that has led to the most incredible success that I think we ever could have imagined. We've had more than 1,500 people engaged. That's actually a duplicated number because some of these folks continued to say no. And that's through this past Sunday. But 471 unique people placed into shelter since that time, including 182 in the biggest low barrier shelter in the city, the Help Center on Sussex Avenue, and 287 in this hotel shelter. So it's been incredible to get that many people off the street, Steve.
You know, Richard, you're a nonprofit. We're a not-for-profit. We've been doing a lot of programming about the role of nonprofits in the age of COVID-19 and moving forward. And the folks at the Healthcare Foundation told us about you, and I know they're supportive and they are for us as well. Here's the question. How hard is it to raise the money you need to do what you do every day as a nonprofit, helping those who are the most vulnerable on the streets of our urban communities?
Nonprofits have this challenge where every year they have a pretty good idea of what it's going to cost, but they start at zero. Unless you have earned revenue, you have to raise all that money. And like all of our other nonprofit friends, we had all of our spring activities canceled, fundraising events, mailings that we were going to send out, the language we were going to use, none of that was applicable anymore. You couldn't get people together. We can't plan for a 5K in September, all the things that everybody's facing. What I would say is that for the revenue side of the equation, we have continued to see the community, the state, and beyond step up and support our efforts as we have stepped up to support especially Newark. So as we have increased, we hired 5 people effective April 1st to increase our outreach and engagement program.
And these,
so
by the way, a few seconds, I'm sorry for interrupting, Richard, a few seconds left, go ahead, I'm sorry.
As we have leaned in and stepped up and spent more to do this work, we have seen a significant increase in support that is helping to keep us going, and I'm grateful for that.
Plug your website if you could.
We are at bridgesoutreach.org.
I cannot imagine more important work that anyone could be doing, not just those on the front lines in hospitals, but on the front lines of helping those and supporting those and being there for those who are out, who are homeless. And that does include many veterans, but a whole range of other people with mental health issues, drug and alcohol related issues. And Richard and his colleagues at Bridges Outreach are working at it every day. Richard, thank you so much for joining us. All the best.
Thank you so much, Steve.
I'm Steve Adubato. We thank you so much for joining us. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, the Russell Berry Foundation, RWJ Barnabas Health, New Jersey Sharing Network, the New Jersey Economic Development Authority, PSE&G, the Port Authority of New York and New Jersey, Gibbons PC, and by United Airlines. Promotional support provided by AM 970 The Answer, and by Meadowlands Chamber. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.